Welcome to Delivering Miracles, a podcast to teach women like you tips and strategies on how you can have a safer pregnancy so you can bring home a healthy baby. I'm your host and your high-risk pregnancy expert, Parijat Deshpande. I can't wait to chat with you. The first time I had heard about chiropractic care, I was in 8th grade, maybe 9th grade. I was pretty young, and a family friend had gone to see a chiropractor after a car accident. And we were at a dinner party one time. We were at somebody else's house. I remember us older kids who were hanging out in the living room just talking after dinner. And the living room was just off of the kitchen. And in the kitchen was where all of the moms were talking about this car accident that had happened. And I kind of had one ear over there on that conversation, trying to listen in on what they were talking about. And I heard the woman who went to see the chiropractor say, I went there for my back pain. My sister-in-law recommended this chiropractor. And somebody else chimed in and went, oh, what did they do for you? And she said, they cracked my back and neck, and all of a sudden the pressure was gone. And you can imagine, as a 13-year-old, I thought, what? They did what to you? They cracked your back? That sounds horrible. That sounds so dangerous and completely insane that you would let somebody do that to you. And I had no idea what that meant. And to be honest, I don't know if even many of the moms over there knew what that meant. But they just, oh, wow, great. Well, I'm so glad you felt relief. I'm glad you're feeling better. They're very supportive. But all that time since then, I had thought chiropractors are scary people and that they do things to hurt you, or it sounds at least very painful. So fast forward a few years, and I was in grad school, and it was a sunny day. I was in my car that I'd had for several years. And I was driving, I can't remember where I was going, but not to school, but I was driving, and I got into a car accident, and the guy just T-boned me. He was just not paying attention, and he hit the back side of my car as I was turning. The poor little car just got so smashed up. It was my special car that I don't have anymore, but it was very special to me. And after we handled all of that, and, we did the paperwork and the insurance and everything, my friends told me, hey, you keep talking about your neck hurting. You should go see a chiropractor. And the first thought that came to mind was the memory that I had about neck cracking. And I'm like, oh my God, I don't know if I want to do that. But I let them convince me. But unfortunately, I couldn't find one to see me early enough. So I went to see a massage therapist instead, who had been trained at a chiropractic school. And he explained a little more about why cracking your back is not actually that scary, dangerous type of thing. And he gave me some idea of what it really means, which helped to an extent. But it still didn't erase the memory completely back from when I was 13. So fast forward a few more years, and I met up with a friend of mine who I have known since I was about 6 or 7 years old. And we danced together for so many years, and we just have so many memories from our dance school and from meeting up and performances. But, as life happens, we went our separate ways. We went to college and grad school, and we just kind of lost touch for a little while. So recently we met up for coffee, and she told me she was a chiropractor too. I was like, oh my God, how is this all coming up? But this time it was really amazing because our conversation had nothing to do with cracking backs or car accidents. It actually was about fertility and pregnancy and how chiropractic care can help you get pregnant and stay pregnant. I had no idea. I had no clue that was even possible. So obviously I was hooked. I was so amazed by everything she was saying, and I knew that I had to bring her on this podcast to introduce her to you. So I'm so excited that she's here today. Dr. Anjali Agrawal uses chiropractic and integrative medicine to provide a holistic approach to healthcare with a focus on pediatric care and women's healthcare. Her goal is to help determine the root cause of the person's symptoms in order to create an individualized, natural treatment plan to achieve optimal health. Her methods combine gentle, hands-on techniques with physiotherapy procedures, dietary modifications, and therapeutic-grade nutritional supplements. Welcome, Anjali. I'm so excited that you're here today.
Thank you. I'm glad to be here.
I'm just so amazed about how much you do and how much you help women and couples during their family building journey. And I'd love for you to tell us about your story and how you got into this field of work.
Yeah, absolutely. I specialize in working with women's health and pediatrics, and I've loved every moment of it. I got into chiropractic a little bit by accident. I I knew I wanted to pursue a route in healthcare, and I didn't quite know what my options were other than going to med school at the time. And so I was on the pre-med journey, and I came home for a summer while I was an undergrad, and I was looking up places for a summer job and came across a chiropractor. Had zero idea what chiropractors did. I mean, I didn't even know that they were involved in healthcare. And I started talking to a chiropractor, and she said she needed help for the summer. And I told her, I don't know anything about what you do, but if you need help, I'm happy to come and check it out. So I started working in her office, and I saw all these people feeling better after their adjustments. And I didn't know what the adjustment did. And so she started adjusting me. And at that time, I didn't really have any symptoms to compare before and after efficacy of the treatment. And so I was getting adjusted, and I thought, okay, great. And at that time, I asked my dad to go and see the chiropractor because he was getting some headaches. And so he started seeing her, and he started feeling better with his headaches. So it's like, okay, well, this is working. I just don't know how it's working or what it's doing. And so there was one day when I got a little bit of a cold. So I called her to say, I don't think I should come in. And she said, that's fine. Why don't you just come in and get adjusted anyway, and then you can go back home? I was like, all right, no problem. So I went in, and she did my adjustment, and I I don't know what happened, but by the time I walked out of the reception area, I felt fantastic. I felt like my cold had just vanished, and I was totally in awe of what had just transpired. And
Wow.
yeah, I was I this was my first adjustment where I felt the difference afterwards. And so that was my hook into looking into this more. So after that, it started my journey of talking to more chiropractors and talking to lots of different people in various health paths, just to make sure that this was something I wanted to pursue. And over the course of that next year, it became very clear to me that this was everything that I had been looking for. And so for those of your listeners who may not be familiar with chiropractic is looking at the function of the nervous system in the body. And as the nervous system governs all aspects of communication between the brain and the rest of the body, it's a pretty important system to look at and make sure that it's
A little bit,
functioning.
yeah.
So over the last 10 plus years of my journey as a chiropractor, it's been really interesting to have conversations with people similar to your experience who may have had a story told to them about someone's experience, maybe not understood it fully, or they may have chiropractic has evolved over a number of years now, but it's still a relatively young profession compared to some of the other professions that are out there. And therefore, it leaves a lot of room for confusion or misunderstanding as to what it's all about. So, my approach to chiropractic is very gentle. I do use my hands to do an adjustment, and the adjustment is to create an alignment of the vertebrae in the spine, and it's not scary. There doesn't have to be this sudden cracking sound that happens, where it looks
Thank you
like
for saying that. Because there's still a little part of me in the back of my head going, oh my God, what is that? So thank you.
yes. No, and unfortunately, media and Hollywood have made it kind of sensationalized, where you
So
do
true.
this like big movement and you look like you're going to rip someone's head off, and that is not what I do, I promise. So,
So good to know.
so one aspect of chiropractic is that it's actually like an art form, in that there are many different techniques that one can use to do an adjustment. Similar to, there are many techniques for massage therapy, or there are many techniques for how you would paint a painting. And so
Hmm.
similarly with chiropractic, it gets a little bit confusing for somebody who's never been to a chiropractor before, because you don't quite know what to expect, and you don't know what quite to ask, and if it's okay to ask that, can you do an adjustment that doesn't sound so scary, or that doesn't involve a lot of force, or and I think that's one of the challenges for most people, is that when they first come in, if they haven't come in from a referral, they just don't know what to expect. So
Right. And that can be scary, especially during a time when you're trying to get pregnant or you're
yeah,
already pregnant. It's a very sensitive time as it is.
absolutely.
And then to put your health in the hands of somebody who you don't even really understand what they do can be really scary. So, can you talk to us a little bit about why someone should reach out to a chiropractor when they're either trying to get pregnant or are already pregnant?
Yeah, absolutely. Well, really, I think everyone should get their spine checked at at any point in their life. The goal of the chiropractic adjustment is to balance the nervous system and to create optimal communication between the brain and the rest of the body. So, really, anybody who has a spine should at least be getting that checked. It doesn't mean that you would necessarily need an adjustment, but chances are pretty high that something has gone out of alignment. And the reason that the spine goes out of alignment can be due to really anything. So, in the chiropractic world, we talk about three main types of stress. And typically, when people think of stress, they think of the mental, emotional stress that we, I think, all experience to some degree. But there's also the physical structural stress, there's the nutritional chemical stress, and any one of these stresses, or any combination of these stresses, can create a shift in our body, and that shift can present as a misalignment of the vertebrae, or misalignment of several vertebrae, in which then the adjustment would help correct that alignment.
I think that's a really great point that you bring up because this is something that I talk about all the time, right? Stress is kind of my thing,
Mm-hmm.
and it's something that comes up a lot for a lot of my clients, but there's this idea that stress is only emotional. And while yes, that is very true that there's a huge emotional factor to it,
Mm-hmm.
there are still physical stressors that create that stress response in your body. And so addressing just the emotional stress isn't enough. You've got to look at your entire body. And it sounds like this is just a really great complementary way of making sure that that stress response is addressed physically.
Right. Yeah. So for those of us who sit in the car for more than half an hour a day, or sit at work, or if we're standing in awkward postures, if we're leaning forward at our desk, if we're on our feet all day long and not getting proper rest, if we're not sleeping in a way that is giving us restful sleep, if we were in a car accident, if we fell and hurt ourselves. I mean, these are really common day-to-day things. It could be that as a child, when you were learning to walk, you fell 1,000 times a day, and because it didn't manifest itself as pain, and you got right back up and started walking again or trying to walk again, those little micro traumas are often what accumulate over a period of time and then result in symptoms somewhere down the road. So that's why it's really common for people to say, once they hit 20s, 30s, 40s, 50s, and beyond, to say, oh, I'm just getting older, or it's just age,
Right.
and that's not entirely true. It's usually that it's been building up over a period of time, and then our body reaches its threshold for the amount of stress that it can tolerate without exhibiting symptoms, and so then it starts to manifest as some kind of symptom, and pain is just one of
Absolutely.
those.
So then how does chiropractic help with fertility?
Yeah, that's a great question. So the idea behind getting adjusted when you're trying to conceive is, or even before you plan on conceiving, is that really you want to have the communication between the muscles and the ligaments and the joints in the entire body, but also a little bit more specifically in the pelvis, communicating as well as it can. So there are a couple nerves that come from the low back that go to the reproductive organs in the body. There's nerves that come from the brain that go to the the endocrine system in general, right? So you have the thyroid, you have the adrenal glands, you have the ovaries, the uterus, the hypothalamus. So all of these organs are involved in hormone balancing and therefore then fertility. And if we can get the nervous system communicating optimally with all these different aspects of the body, then we have a much better chance of creating a stronger baseline and a stronger chance of not only someone getting pregnant, but also then being able to hold the pregnancy for the duration of the time.
That's amazing.
Yeah.
It's not something that had thought of as a connection at all. I mean, it's like I said at the beginning. I assume chiropractic care has to do with your back, and it just never occurred to me that, I mean, as you explain it, it makes so much sense that yeah, you've got to have your nervous system communicating properly. You've got to have, and all of these organs and our nerves and our muscles, they're all connected. We can't just look at one aspect of it and say that must treat the entire thing. There's no way.
Right.
So it's amazing that you're sharing this. I remember when we were talking last,
Mm-hmm.
you shared something about how we tend to normalize symptoms in a way that don't necessarily need to be normalized. Like, for example, women who are pregnant kind of say, oh, well, I'm going to have aches and pains. Oh, well, I'm going to
Mm-hmm.
have morning sickness. I feel terrible, but that's just part of it. And we just kind of normalize and say, well, this is just part of the deal. And you were saying that you have a completely different approach to that, that there are actually things you can do to minimize or even completely get rid of some of these symptoms that we think are normal pregnancy symptoms. Can you talk a little bit about that?
Yeah, absolutely. I think that's actually probably the biggest myth, if you want to call it a myth, that I talk about with all my patients, whether or not they're pregnant, is that just because something is common doesn't mean that it's normal. And I think that's a big mental shift that has to happen
Oh, I
because
love that. I feel like we need to just repeat that for everybody that's listening, because that's just because it's common doesn't mean it's normal. Holy cow, that
right.
just blows my mind. It's so true.
Yeah, it absolutely is something that I talk about every day, because whether you're talking about morning sickness or food cravings or food aversions or sciatica or heartburn or back pain or headaches or PMS symptoms or just general day to day anything, we can write it off as, oh well, I'm pregnant, I'm supposed to have X, Y, and Z symptoms, or it's normal to have X, Y, and Z symptoms, or I'm going through a growth spurt, it's normal for me to have growing pains, or whatever these symptoms are. We write it off as, well, okay, no big deal, or we find a way to manage it, and move on. And that's, if we can find a healthy way to manage it, that's great. But the challenge for most of us is that we then end up suffering through it and just dealing with it, and then over time it starts to become our new normal, because we've now gotten used to getting a headache every day for at least, or maybe a couple times a week, or we get heartburn a couple times a week, or maybe every day, or once a month, and we just say, oh well, no big deal.
Right. And you know what comes to mind when you talk about this is specifically endometriosis,
Oh yeah.
especially in young women who
Right.
have not been told that such severe pain is not normal, that
Mm-hmm.
this is not just heavy periods, or
Right.
this is not on the normal spectrum
Right.
of reproductive health. And you just grow up and you just get used to that pain, and suddenly your pain threshold is so high because
Mm-hmm.
you've just lived with it for years and years.
Right.
And it makes me wonder, is that something that you work with women on? Is the conditions like endometriosis, PCOS, is that something that comes up in your practice?
Absolutely. And I think that those are all things that we would address ideally before someone is trying to get pregnant. But oftentimes, if they're not an existing patient already, then usually I'm meeting them while they're already pregnant, if they're not coming in specifically for fertility support. And so then hormone balancing becomes something that we address with anybody who is exhibiting any kind of symptom. And that goes back to making it part of the conversation of understanding that this is a symptom which indicates that something is out of balance in the body, right? Your body wouldn't just exhibit symptoms for the sake of having symptoms. There's
Right.
a
It's
point.
exactly what I say. You're
Right.
so right. It's exactly what I say all the time on this podcast and to all my clients. Your body's always talking to you, and it
Right.
is telling you that something's off. It's just our job to listen and pay attention and then do something about it.
Absolutely.
Yeah, I love that. So, can you then talk to us, or maybe you have a client that you can tell us about who came to you for fertility or for pregnancy support? Can you talk to us a little bit about a success story that you've seen?
Sure. Yeah. There's luckily lots of women who have really benefited, which has been awesome to see their journey. So one of my most recent ones, she came in her first trimester, and she was getting morning sickness, and she happened to come in because she had been a patient a while ago, and she had come in previously because of neck pain and shoulder pain, and then she stopped care for a little while, and then came back, and she came back right after she found out she was pregnant, and she was starting to get more headaches, and so she came in for that, and then she didn't even actually tell me she was pregnant initially. But then, as we were having our conversation, and we basically did a new evaluation again because it had been a while since I had seen her, and we were talking about some of the hormonal symptoms and the neck pain and shoulder pain that she was getting previously when I had seen her, and then she was talking about her energy levels being really low, and so then I asked her, are you trying to get pregnant, or do you think you may be pregnant? And she said, I just found out I'm pregnant. She said, does that have anything to do with my headaches? And I said, well, I don't know.
Like, oh,
And
okay.
so,
It's a new factor to consider here.
and again, because anything can cause anything, it obviously, when you get pregnant, that's good and maybe not so good stress in so many different capacities. every aspect of the stress spectrum, right? It's emotional, mental preparation, it's structural,
Absolutely.
physical changes, it's nutritional, chemical changes happening internally, and your demands, the body's demands change, and so every aspect of that is now being affected and influenced. So we started working with her. We did a combination of adjustments and some nutritional support, and within 2 weeks, her headaches went from being daily to pretty much gone.
Oh, amazing.
Yeah, and then her energy level started picking up, and it was really interesting for her because all her friends who and her family who had known her for so many years, and then to see this drop in her energy levels and things like that, they kind of started assuming that she was pregnant, but of course no one asked her at that time.
Right.
But when her energy level started picking up again, they kind of dispelled their thought that she was pregnant because
There's no way a
yeah,
pregnant woman in the first trimester has energy.
yeah, they were. And so she told me that after, because I told her later, they're like, oh, they didn't think I was pregnant anymore because I had all this energy back. And I'm like, awesome. Um, and so then she started coming in for her adjustments, and we were working on maintaining the alignment in her pelvis and the rest of her spine. And we basically continued that throughout her whole entire pregnancy, and it was awesome because I got to just do a house visit for her a week or so after she had her baby, and I got to check her alignment and meet her baby and check her baby's alignment. And it's so awesome to see women after they've had body work done throughout their pregnancy, because it is vastly different in terms of how their whole body is functioning. The whole experience of pregnancy and the birth process is actually extremely different because your body is just at a much better state of being, and the recovery is much faster. And it was just really, really fun to see. And that just happened last week. So it's been really neat
Oh,
to, to be part of her journey. But
that is
yeah,
amazing. That is so, so amazing. And
yeah.
it really just hits home how important it is that if you are trying to get pregnant, or if you are pregnant and struggling with really anything,
Hmm.
that it's a good idea to consider alternative options like seeing a chiropractor to help you on your family building journey.
Right.
Anjali, what are your final words of hope for couples who are trying to conceive or a woman who is already pregnant?
I would say probably things that people have heard before, but really just listen to your body and don't be afraid to ask questions. There are lots of different health modalities out there that are available to people, which is awesome. And there isn't one right solution for everyone 100% of the time. So talk to different people, explore different options, and really, really, if you can remember that if you have a symptom, please listen to your body and recognize that there is something that your body is trying to tell you. It may not be a huge deal, but at least pay attention to it and recognize that there is something that should be balanced out, and that chiropractic can be very gentle and very non-scary, and it's very, very safe at any point in your journey of pregnancy and postnatal care for pediatrics at any age. So it's a very, very awesome treatment modality that is available, which I'm really happy to be a part of.
That's awesome. And where can people find you if they want to reach out to you, if they want a consultation or to come in and see you?
Yeah, absolutely. So I practice in Los Altos in the Bay Area. Um, there's my website, which is backinbalancehealth.com. That's BACKINBALANCEHEALTH.com. And my office phone number is 650 383 8853. And I'm happy to do complimentary phone consultations to help someone figure out if this might be the right option for them, and then, or they're welcome to come into the office and we'll do a full history consultation, evaluation, and adjustment.
Fantastic. And if somebody's not in the Bay Area, can they still call you to have a
Absolutely.
phone consultation?
Absolutely, yeah. It's a little bit harder for me to do the adjustment over the phone, but I can, I'm happy to do the consultation and help find somebody who might be a good fit for them.
Fantastic. Thank you so much
Thank
for being here
you.
today. I have learned so much and I'm really excited about checking out chiropractic now.
Thank you.
Oh my gosh, this was amazing. I mean, first and foremost, I'm just so relieved to know that it's not scary. And there's no way that it can be scary if it's safe to do when you're on your fertility journey or when you're pregnant, especially, or even with babies, right? And it just really hits home again how important it is that we listen to our bodies. Pay attention to what your body is saying and keep your mind open to the idea that, hey, you don't have to suffer and struggle through something just because everybody else is. I mean, that was kind of the biggest takeaway for me too, is that just because it happens all the time, infertility, pain during your periods, not ovulating, pregnancy aches and pains, morning sickness was the kicker. You just assume that it's normal, but just because it's happening doesn't mean you can't do something about it to fix it, to help you. Because imagine what your pregnancy experience will be like if you start your body off at its most optimal and you can enjoy this process that you're fighting so hard for. And imagine what that's going to feel like then to be able to heal faster afterwards once the baby's here, so you can really be present for that life that you're dreaming of right now. So if you're looking to get pregnant, if you're struggling with fertility issues, if you're already pregnant, I really suggest you consider alternative options like chiropractic to help you on your family building journey. Thank you so much for joining me here today. If you enjoyed today's episode, I'd love it if you can head over to iTunes and leave a 5-star review so we can keep getting more amazing guests like Anjali and we can continue providing you content that's going to help you through your high-risk pregnancy. If you're ready to have some peace of mind that you're doing everything in your power to protect your baby, I'd love it also if you could schedule a consultation, and I'd love to chat with you. You can visit my website at parijatdeshpande.com. And I would also love to stay in touch. So follow me on Twitter and Instagram. You can find me at Parijat Desh. That's Parijatdesh. Every body is different. Every fertility journey, every pregnancy is different. It only makes sense that you would look for personalized care, and chiropractic may be that answer for you. Take it one day, one step at a time. You can do this.